Behind me are the labs of a female in her late 40s who has been struggling with recurrent UTIs for several years now, despite the countless visits to her urgent care. And on top of that, she's also worried about extremely high levels of her liver enzymes, and now she's starting to get hormonal symptoms and thinks that she's got to do something before menopause sets in. So let's take a look at what we found. So she had previous labs prior to coming in, and we're seeing that the kidneys are definitely being affected from those UTIs, and her liver as well. Both of these enzymes are cranked up way higher than we want to see. So we tested her immune system to look at any food allergies that are there, and we got 15 foods causing histamine in her body every day. So a mix of 2 different forms of yeast, a few grains in here, and then a lot of fatty-based foods, which pointing to that gallbladder and what's going on with the liver makes a ton of sense. We ran some blood work as well, and we got her immune cells being crazy low, and a lot of these come from the belly, which we'll see on some later testing, but we know her immune system is being affected. So the enzymes that we saw were high previously are now nice and low. So this ALT and AST showing up in the 20s now, which is great. GFR starting to come back up, but definitely more work needs to be done there. Cholesterol building up too, showing that we got a bunch of healing that is currently taking place in her body. And vitamin D super low, which your immune system really needs vitamin D to have normal function. We included some hormone testing on these labs as well, which will be cool to see how these change later on, but really the big thing to look out for here is how high this cortisol was, and this lab was taken at 12:30 in the afternoon, so way too high to have 18. We had female hormones in addition to the blood work too, and all of these are showing up low. Pregnenolone looking good, but progesterone and then some of the estrogens coming up low because we have that immune stressor, which is taking away resources from the body and directing it elsewhere. On her Genova test, we had pancreatic enzymes showing up low. Protein was looking good, but then a lot of the fatty foods that she was eating aren't even being broken down or absorbed. So this is very widespread out. We want to bring these diamonds back to the middle. The immune system not picking up on infections that are on later pages, and then her prebiotics are super low. And now looking at those infection pages, the Citrobacter highly associated with UTIs and is potentially pathogenic, as well as a strep infection and bacillus species as well. And these are opportunistic infections, and they should not be within the GI. So for this patient, there were multiple factors that are affecting her and giving her these symptoms in the first place, but from all that testing, now we know a clear path as to how to get her back to normal. And her uterine pain and burning has now calmed down. We've started to move that infection out of the UTI, boosting up her immune system, supporting hormones where we can, supporting the upper GI from all those food allergies, and now we got a plan going forward. So if this is an issue that you've been seeing and you've had these recurrent UTIs, or your liver's showing elevated enzymes, the immune system's in trouble, we have hormonal symptoms, there is a way to get this back to normal. We just got to get the right labs done and figure out what your body needs in order to give you the resources to adapt and return your body back to normal. So send us a DM, hit the links in the bio, reach out to us, and we can get you tested, or comment testing down below, and we'll get you the proper testing.